Good afternoon. Millions of your tax dollars earmarked for hospitals all across New Mexico. State lawmakers were shocked and upset about those tax dollars not being spent or used by hospitals and funds not being dispersed from the state. News 13's Natalie Wattis has details.
I think it would be worth our while to maybe pass legislation that says that if you don't provide us data, financial data that we need, we don't give you any more money.
State lawmakers expressing shock and frustration over a new report from the Legislative Finance Committee concerning your money being put into hospitals across New Mexico. The report had four main findings. One, that hospitals became less profitable between 2022 and 2023.
While net income may have declined, hospitals are still making a significant amount of money in revenue.
Analysts say the money is going elsewhere. Second, the state invested hundreds of millions into hospitals and rural providers for startup services. But as of now, the money hasn't been touched.
Yet hospitals were not dispersed any funds as of September.
Third,
the Healthcare Quality Delivery and Access Act performance measures do not include metrics measuring healthcare outcomes and access, which is included in the name of the act, over the next 5 years.
And lastly,
New Mexico has the highest proportion of hospitals owned by private equity in the country, with 38% or 17 out of 43 hospitals owned by private equity firms.
The report cites research that says the quality of treatment and the number of patients decreases when hospitals are owned by these firms. The presentation made lawmakers ask, why haven't hospitals touched the money?
Is there so much red tape involved in accessing money that's why we're having such a hard time expending the money?
And the bigger question one lawmaker is asking, why is it so difficult to get the information?
It's ridiculous that the overseeing body, the legislature, has to IPRA to get information, and they're asking us for hundreds of millions of dollars, and we can't know who's doing what or where the money's going.
Natalie Wattis, KRQE News 13.
That report also shows that medical malpractice in hospitals in this report has risen only slightly compared to what lawmakers had expected. The report did not name any hospital owned by a private equity firm or how they spent their money.